Hi everybody, this is Dr. Lewis of Coastal Wellness in Lisbon, and a lot of people have the notion that when we are in pain, maybe we shouldn't be moving, or maybe we shouldn't be doing things with those joints or those tissues because they're inflamed and they need a little bit of rest. And that can be the case, especially for acute injuries, but for chronic stuff, assuming that you don't have any instability, if you're really sensitive to certain types of movement, then maybe you have a joint or a area of the body that isn't being sufficiently moved or stimulated on a regular basis. So the more blocked up or jammed a joint gets, the more it can get used to that, and the more that we ask of that joint. So when we start to try and use that joint to move, for example, if your arm, for example, is in a cast for a long period of time, as soon as that cast comes off, we start to move the arm. It feels a bit sensitive, it's a little bit sore. Because movement is a real desensitizer for our body, and we need good movement in order to make sure that our tissues are actually healthy. But one area for most people that gets really jammed up, and good reason for that, is we spend a lot of time in this rounded forward posture, sitting on a computer's desk, studying, working, whatever. And when we go to if we go to exercise, we ask this area of our spine, this lower transitional area of our spine, the low back, L5, S1, an area that a lot of people get hernias. When we go to do things during our life, this is a transitional area. It's when we're bending, squatting, or whatever, we're asking this joint to be able to move and be able to be stable when we contract. And if it's not moving well, then it's difficult to do that, and it can often lead to a lot of sensitivity or pain. And one exercise that I really like in order to add some more mobility to that area is something that you can do when you're seated. I highly suggest doing this. If you have any of these symptoms going on in the lower part of the back, this might be a good exercise for you to do prior to exercise, as a way to break up your day, or just as a side thing that you can work on a regular basis. But one exercise I really love is to use band. I love having bands. They're really great for trying to focus movement or train movement in certain specific areas. And what I like to do with this is straighten my arms, take the band behind my back, and focus it right on that lower part of the spine. And you're gonna stretch your arms forward as far as you can. Ideally, you can do this on a bench of some sort that you're straddling. I like the height of this. I mean, most people don't have this at home. This is a table, but you could figure out something similar. Anyway, strengthen your arms, straighten the arms forward. In this position, we're just going to do some pelvic tilts. So forward and backward, tilting the pelvis forward and backward. And you're going to feel a little bit of discomfort possibly when you're going into extension. And that's okay. Just brush up against the pain and keep moving. Try to do this for a few minutes. And if you're working long hours during the day, it's something that you could be doing while you're seated, just doing pelvic tilts without a band. But when you have a moment, when you get home, doing a little bit of challenge in this area, using the band forward and backward, let the band pull you into more extension when you come forward, and then press against that band as you try to mobilize those tissues backwards. Anyway, try that out for a few minutes, or try to add it into your routine, see if it makes a difference for you. Have a good weekend, everybody. All the best.